What if the warning signs were already there, but you just didn't know how to spot them? Every year, thousands of men over 50 miss these subtle symptoms until it's too late. Could your body be trying to tell you something right now? Don't wait for a diagnosis. In the next few minutes, you'll discover what
Prostate
every man
cancer
must
is
know
now one of
before
the
it's too
most
late.
common cancers
Among men over 50. But what many don't realize is that it often grows silently, without pain or warning, until it becomes life-threatening. Did you know that 1 in 8 men will be diagnosed in their lifetime? And yet, with early detection and small lifestyle changes, it's also one of the most preventable. In this video, we'll uncover the early warning signs, hidden risk factors, daily prevention habits, and the tests that could save your life. So stay with us till the end. You might just change the course of your future. Subscribe now to Health Span Plus for
Segment
more
1.
life-saving health
The
tips
silent
for older
danger.
adults. Why prostate cancer often goes unnoticed. Prostate cancer is often called a silent disease because in its early stages, it may not cause any noticeable symptoms. This makes it especially dangerous for older adults, as it can quietly grow and spread without obvious warning signs. Many men over 50 are unaware that something serious is happening inside their body because the symptoms can be subtle or even mistaken for normal signs of aging. For example, symptoms like frequent urination at night, a slower urine stream, or mild pelvic discomfort might not raise any alarm. A man may think, "I'm just getting older," or "This is probably just an enlarged prostate." That assumption is understandable, but it can be risky. In many cases, these early signs are the body's way of sending a quiet message, and ignoring them could delay diagnosis and treatment. One of the biggest challenges is that prostate cancer can develop without pain. Unlike other illnesses that cause sudden or severe discomfort, prostate cancer grows slowly and quietly in most cases. It may not affect day-to-day life at first, which leads many men to put off doctor visits or health screenings. By the time more serious symptoms appear, the cancer may already have progressed to an advanced stage. Let's imagine a real-life scenario that brings this point home. Meet Robert, a 62-year-old retired teacher. For over a year, he noticed he had to get up 2 or 3 times a night to use the bathroom. He also felt a bit more tired than usual, but figured it was just part of aging. He didn't mention it to his doctor because he thought it was nothing serious. But at his next yearly checkup, his doctor suggested a simple PSA test, a blood test that can detect prostate cancer. The results were concerning, and after more tests, Robert was diagnosed with early-stage prostate cancer. The good news? Because it was caught early, his treatment had a much higher chance of success. Today, Robert is cancer-free and grateful he didn't ignore that quiet signal from his body. The key takeaway here is this: just because something seems small or harmless doesn't mean it is. Prostate cancer is most treatable in its early stages, but you can't treat what you don't know about. That's why it's so important for men over 50 to be aware of these quiet warning signs and to talk openly with their doctors, even about things that seem minor. Leave a comment if you've ever been confused by unusual health changes. Let's support each other with honest conversations and shared wisdom. And remember, you're not alone. At HealthSpan Plus, we're here to help you stay informed, strong, and in control of your health every step of the way. Don't forget to like and subscribe for more life-saving information every man over 50 should never ignore. Prostate cancer often begins silently, but there are certain warning signs that every man over 50 should pay close attention to. These symptoms may not always be obvious or painful, but they can be the body's way of signaling that something serious is developing. Ignoring these signs could delay diagnosis and treatment, which is why understanding them could quite literally save a life. 1. Frequent urge to urinate, especially at night. One of the most common early signs is needing to urinate more often than usual, especially during the night. Many men think it's just a normal part of aging, but a persistent change in urinary habits can indicate an issue with the prostate pressing on the bladder or urethra. Waking up multiple times to urinate may be a sign that something more serious is going on. 2. Weak or interrupted urine flow. Another warning sign is a weak stream or trouble starting and stopping urination. If you notice that your urine flow has changed or that it feels like you can't empty your bladder completely, it might not be just an enlarged prostate. It could be a tumor pressing against your urinary tract. This change should be discussed with a doctor without delay. 3. Blood in urine or semen. This is a more alarming symptom that should never be ignored. Seeing blood in your urine or semen is not normal and could be a sign of several conditions, including prostate cancer. Even if it happens once, it's important to get checked right away. Early detection can make all the difference in successful treatment. Pain in the hips, lower back, or pelvis prostate cancer can sometimes spread to bones, especially in advanced stages. If you feel persistent pain in your hips, lower back, or upper thighs, it's not something to dismiss. Don't chalk it up to arthritis or aging without first ruling out something more serious. 5. Erectile dysfunction. ED. While ED is common as men age, it can also be a warning sign of prostate problems. If it suddenly develops or worsens, it may be linked to cancer affecting the nerves or blood flow. It's important to talk openly with your doctor, even if it feels uncomfortable. 6. Sudden weight loss. Unintentional weight loss, especially if you are not dieting, can be a sign that your body is fighting something serious. Cancer often causes metabolic changes that result in fat and muscle loss. If you lose more than 10 pounds without trying, pay attention. 7. Unexplained fatigue. Fatigue that lingers for weeks, even after resting, can be a subtle but serious symptom of many chronic conditions, including cancer. If you're constantly tired and don't know why, listen to your body and schedule a checkup. If any of these sound familiar, please talk to your doctor. And don't forget to subscribe to HealthSpan Plus for more clear and caring guidance on aging, health, and prevention. Remember, it's never too early to act, but it can be too late. Top risk factors. Who's most at risk and why prostate cancer is one of the most common types of cancer affecting men, especially those over the age of 50. Understanding the risk factors can help men take action early, before symptoms even appear. Some of these risks can't be changed, but knowing them gives you the power to stay alert and proactive. Others are lifestyle-related and can be improved through simple changes. In this segment, we'll explore who's most at risk and why. 1. Age, the strongest risk factor. Age is the biggest risk factor for prostate cancer. Men over 50 are at significantly higher risk, and the risk continues to rise with each passing decade. In fact, about 60% of prostate cancer cases occur in men over age 65. This is why regular screening and awareness are so important for older adults. The body changes with age, and staying ahead with knowledge is key. 2. Family history. Genetics play a role. If you have a father, brother, or close male relative who has had prostate cancer, your risk is more than doubled. Genetics can influence how your body handles abnormal cell growth. If multiple relatives have been affected, especially at younger ages, that risk increases further. This means that family history should never be ignored. It's one of the most important reasons to start screening earlier. 3. Diet and lifestyle habits. Daily choices matter. What you eat and how active you are every day also play a role in prostate health. Diets high in red meat, dairy, or processed foods have been linked to increased prostate cancer risk. On the other hand, foods rich in antioxidants, like tomatoes, broccoli, green tea, and leafy greens, can support prostate health. Lack of exercise, obesity, and chronic inflammation are also known to raise the risk. The good news is that these are controllable factors. Simple choices, like walking daily, eating more plant-based meals, drinking plenty of water, and limiting processed foods can make a meaningful difference in long-term health. 4. Race and genetic background. Higher risk for some studies show that African American men are more likely to develop prostate cancer and are more likely to die from it than men of other races. The reasons may include both genetics and disparities in healthcare access or screening. If you're part of a higher risk group, it's especially important to speak to your doctor about early and regular screenings. 5. Hormonal imbalances. Testosterone and risk. Prostate cancer is influenced by male hormones, especially testosterone. Some research shows that higher levels of certain hormones may fuel the growth of cancer cells in the prostate. While hormone levels change naturally with age, abnormal imbalances can be a risk factor worth discussing with your healthcare provider. Share this video with a brother, husband, or friend. It could be the conversation that saves a life. Subscribe to HealthSpan Plus for clear, compassionate advice on aging, prevention, and staying strong after 50. We're here for your journey. What you can do today. Prostate cancer prevention habits. When it comes to prostate cancer, prevention is powerful. While you can't change your age or family history, you can take meaningful steps each day to reduce your risk. These habits aren't extreme. They're gentle, manageable lifestyle changes that support your prostate and your overall well-being. In this segment, we'll walk you through 5 important prevention habits every man over 50 should know. Think of this as your daily wellness checklist for a healthier, longer life. 1. Eat anti-inflammatory foods daily. What you put on your plate matters. Some foods naturally help fight inflammation, which plays a role in many cancers, including prostate cancer. Add more tomatoes to your meals. They're rich in lycopene, a powerful antioxidant. Enjoy steamed broccoli and try a soothing cup of green tea each day. These simple, affordable foods can support healthy cell growth and help protect your prostate. Eating the rainbow, fruits and veggies in all colors, also gives your body the vitamins it needs to stay strong. 2. Stay active and maintain a healthy weight. Regular physical activity does more than keep your heart strong. It helps regulate hormones, reduces inflammation, and keeps your immune system sharp. Just 30 minutes of walking a day can make a big difference. Maintaining a healthy weight is also important, as obesity is linked to a higher risk of aggressive prostate cancer. You don't need to join a gym. Light stretching, gardening, or dancing in the living room all count. The key is consistency, not intensity. 3. Limit red meat in processed foods. Many studies suggest that diets high in red meat, saturated fats, and processed foods are linked to a higher risk of prostate cancer. Try cutting back on fast food, packaged snacks, and heavy meats. Instead, enjoy more plant-based proteins like beans, nuts, and fish rich in omega-3s. A simple rule to follow: if it's fresh, colorful, and grown from the earth, it's probably a better choice for your health. Prioritize sleep and manage stress. Chronic stress and poor sleep affect more than your mood. They can disrupt your immune system and hormonal balance. Both are linked to increased cancer risk. Practice gentle habits like deep breathing, quiet reading before bed, or spending time in nature. Aim for 7 to 8 hours of sleep per night and speak to your doctor if you're struggling with insomnia or anxiety. Caring for your mind is part of caring for your body. 5. Schedule routine. Health checkups. Finally, don't wait until you feel something is wrong. Prostate cancer can grow quietly, so regular screenings are essential. Talk to your doctor about PSA tests or prostate exams, especially if you're over 50 or have a family history of cancer. Early detection could make all the difference. Hit the bell icon after you subscribe to HealthSpan Plus. You'll get gentle reminders when new health videos go live. Remember, small habits today can lead to a stronger tomorrow. Let's take this journey together. Screening that saves lives, tests. Every man should know. One of the most important steps every man over 50 can take to protect himself from prostate cancer is regular screening. Early detection is key because prostate cancer often grows slowly and silently. When caught early, it's usually much easier to treat and manage. In this segment, we'll talk about the 2 main screening tests every man should know: the PSA test and the digital rectal exam, DRE. We'll also discuss how often you should get screened and why these tests truly save lives. 1. PSA test, what it is and when to get it. The PSA test measures the level of prostate-specific antigen, PSA, in your blood. PSA is a protein produced by the prostate gland. While some PSA is normal, higher levels may suggest the presence of prostate cancer, an enlarged prostate, or an infection. This blood test is simple and quick, just a small sample from your arm. Men over 50 or younger men with risk factors like family history or African American heritage should discuss the PSA test with their doctor. Usually, doctors recommend starting regular PSA testing around age 50, but if your risk is higher, your doctor might suggest earlier screening. The PSA test is not perfect. Sometimes PSA can be elevated for reasons other than cancer, but it remains a valuable tool to catch potential problems early before symptoms appear. 2. Digital rectal exam, DRE. Why it's still important. The digital rectal exam, or DRE, involves your doctor gently feeling the prostate gland through the rectum with a gloved finger. This quick in-office exam allows the doctor to check for abnormalities such as lumps, hard areas, or changes in size. Though it might feel uncomfortable or awkward to some men, the DRE is still an essential part of prostate health screening. Some prostate cancers don't cause a rise in PSA, so this physical exam can catch issues the blood test might miss. 3. How often should men over 50 screen? For most men, the general recommendation is to begin screening at age 50 and then have a PSA test and DRE every 1 to 2 years, depending on your doctor's advice and your risk factors. Men with a family history of prostate cancer or who belong to high-risk groups should consider starting screening earlier, often around 40 or 45. The key is regular follow-up. Screening isn't just a one-time thing. Consistent monitoring helps track any changes over time and allows your doctor to act quickly if something unusual appears. 4. The role of regular checkups in saving lives. Regular checkups and honest conversations with your healthcare provider can make all the difference. Screening is about empowering you with knowledge and giving you a chance to catch problems early when treatment is most effective. Many men avoid these tests because of fear or embarrassment, but it's important to remember, don't fear the test. Fear what happens if you avoid it. Early detection can save your life or give you more years to enjoy with your loved ones. If you found this information helpful, please like this video, share it with friends or family, and subscribe to HealthSpan Plus for more gentle, clear advice on aging well and staying healthy after 50. Remember, your health is your greatest wealth. Staying proactive with screening tests is one of the smartest things you can do to protect yourself and live a full,